The enrollment process for the National Health Insurance Plan has begun, and out of the many licensed employers in the Turks and Caicos, only 330 have enlisted in the soft enrollment, says officials who were present at this morning's press conference. The plan, which promises to provide quality health care at the two new hospitals in Grand Turk and Providenciales, will also provide all essential medical services to TCI residents. Officials of the NHIP say 500 to 550 employer groups have been contacted and instructed on how they can make contributions to the plan. An estimated 20,000 workers are expected to be enrolled in the National Health Insurance Plan, the plan which has come under fire in recent weeks for its lack of transparency and its contributions, which are due months before the new hospitals are complete, was explained to media officials this morning.
To answer your question, why are you're paying for something before you get it? Not uncommon in any private-public partnership. Okay. The other thing you asked, you wanted to know what level of care you can expect, whether that is going to change. You'll have the same level of care that you are receiving now. Namely, the overseas treatment program remains.
The plan, which will pay for primary and secondary health care and state-of-the-art health care facilities for Turks and Caicos residents, will be funded by the country's working population, a population which consists mostly of foreign workers and expatriates. John Smith, chairman of the National Health Insurance Plan, explains that contributions will not increase if there is a demise in the workforce population.
It is a concern, right? Has been a concern of the board. Right. And what we've done, we've got a revised actuarial report, and we conducted a level of sensitivity analysis which allowed us to better understand what those levels are and what effect what you've just described potentially could have on the plan.
It was also revealed that there will be a registration process for the private physicians who want to provide health care services to residents under the NHIP. That registration will be done by Director of Medical Services, Dr. Rufus Ewing. CEO of the National Health Insurance Plan, Brian Hogan, explains that procedural course.
IntraHealth is our largest preferred provider, but we are interested in working with private providers as well. And we're working on what those rules are. and that's a relationship that will evolve as we go forward. So yes, the private providers will be participating providers within the National Health Insurance Plan. I believe that there are discussions going on between the private providers and IntraHealth.
The total contribution cost of the NHIP is 5% of wages, divided equally at 2.5% between the employer and employee. The first contributions to the NHIP are due between November 1st and December 14th. Persons who refuse to make contributions can face imprisonment.
There are penalties, however, for the individuals who don't pay, and for the employers who don't remit. Now, it is imperative that everyone shares their civic responsibility. So anyone who feels, for whatever reason, and it's a choice, if you choose not to pay when you ought to pay, you choose to expose yourself to the consequences of your actions.
Talks are ongoing between NHIP officials and the National Insurance Board, who will act as a collection agent for the NHIP contributions. Nationwide NHIP enrollments begin next week. For WIV4 News, I'm Angie Toussaint.